Mr. President, last week on July 2nd, the Tuesday before July 4th, Independence Day on Thursday, the administration made an announcement that they were going to delay implementation of a key component of the ObamaCare law. I think that came as a surprise to a lot of people because the expectation has been all along that come January of this next year that many of the provisions in that law were going to go into effect. And tomorrow, a majority of the Senate Republican Conference will be sending a letter to President Obama asking for a permanent delay of the employer mandate. Now, I say permanent delay because they talked about delaying it for 1 year. In making the announcement about the delay of the employer mandate, the administration unilaterally acted and failed to work with Congress on what is a very significant decision. This action finally acknowledges some of the many burdens that this law will place on job creators. And I believe the rest of this law should be permanently delayed for all Americans in order to avoid significant economic harm to American families. In response to questions about the administration's decision, the President's senior advisor, Valerie Jarrett, said, and I quote, "We are listening," end quote, while referring to the concerns of the business community over the onerous employer mandate that will result in fewer jobs and employees working fewer hours. We've been listening as well, and as more employers have attempted to understand the burdensome requirements in the President's health care law, the louder their outrage has become. In particular, small to medium-sized businesses are simply drowning in their efforts to understand all of the regulations. We're also listening to the views of the American people. A recent Gallup poll from this week showed that a majority of Americans still disapprove of the health care law. The survey showed that 55% of respondents disapprove of Obamacare. A Gallup survey last month revealed that for every one person who believes that they will be better off under Obamacare, 2 believe they will be worse off. Opposition to the health care law is growing, and it will continue to grow as more Americans realize that the law is built upon broken promises and will result in higher health care costs and more taxes. Under the individual mandate, the IRS, which is still under multiple investigations for unfairly targeting conservative groups, will play a central role in the implementation of the health care law in our country. Last fall, the Congressional Budget Office estimated that nearly 6 million Americans, primarily in the middle class, will have to pay a tax under the individual mandate, which is 2 million more than was initially estimated. When the Affordable Care Act is fully implemented, the average individual mandate tax will be nearly $1,200, which clearly contradicts the President's previous statement that the individual mandate is, quote, absolutely not a tax increase, end quote. Further, families are facing significant increases in premiums. The Wall Street Journal recently published an analysis of premiums and concluded that under the health care law, some Americans will see their premiums double or even triple, which is the opposite of the promise that was made by the President that premiums would go down by $2,500 for American families. Given the widely held belief by the American people that the Affordable Care Act will not fulfill its promises, it will result in higher costs for American families, I believe this law should be permanently delayed. This law is unworkable, harmful to the economy and to American families, and actions to delay the employer mandate is an acknowledgement of this very fact. Public opinion about the Affordable Care Act has been consistently low. Perhaps Americans don't like it because it's affecting their jobs. 4 in 10 small business owners say they've held back on hiring, and 1 in 5 owners say they have let employees go due to the health care costs associated with the Affordable Care Act. As implementation of the law continues, the number of small business owners who take these steps could increase. Employers are also cutting back on hours in anticipation of the mandate. Even though enforcement of the employer mandate may be delayed, employers still know this is coming down the pike and will continue to make adjustments to their workforce in anticipation of the new mandates. A new mandate will also be imposed on individual Americans. On January 1st, Americans will be forced by their government to buy a product, health insurance, for the first time ever. This mandate will be enforced by tax penalties administered through the Internal Revenue Service. The Obama administration has requested over $400 million in funding and nearly 2,000 bureaucrats for the IRS to implement the individual mandate and 46 other statutory provisions. The blizzard of Obamacare rules and regulations continues. Regulators have now written over 20,000 pages of Obamacare-related rules and notices in the Federal Register. And just this last week, another 606 pages of new regulations were released that were designed to assist in implementing this massive law. It's no wonder the public outcry from employers was so loudly opposed to the employer mandate. American families are also struggling to understand how this complex, burdensome law will affect them. And it is critical that the President and his administration listen to the American people and permanently delay this law. And I would add, Madam President, if you look at the impact on the economy, not only is this about higher premiums for middle-class families in this country, not only is it about higher taxes that are going to be imposed upon medical device manufacturers, on health insurance plans, pharmaceutical companies, all of which, by the way, will be passed on to individual consumers. It's also about the impact this will have on jobs in the economy. If you look at just the numbers that came out last week and what they said about the impact of policies coming out of Washington, D.C., and the impact that they're having on jobs in this country, the number of people working part-time for economic reasons, sometimes referred to as involuntary part-time workers, increased by 322,000 people to 8.2 million total people in the month of June. These are people who are working part-time because their hours have been cut back or because they were unable to find a full-time job. The real unemployment rate, or what we call the U6 rate, is 14.3% for June of 2013, which is an increase of a half percentage point over the previous month. That's the total percentage of unemployed and underemployed workers, making the real number of unemployed Americans in this country 22.6 million people. These are people who are unemployed, want work, but have stopped searching for a job or are working part-time simply because they can't find full-time employment. And I would add, Madam President, that when policies coming out of Washington that are, I think, very exemplified by the Obamacare mandates are imposed on the American economy, it makes it harder for job creators and employers in this country to create the jobs that are necessary to affect these numbers in a positive way, to get Americans back to work in a full-time way, and back to work in a way where they are actually increasing their take-home pay rather than having it decreased by higher costs for everything that they have to spend their incomes on, including the cost of health insurance coverage. You know, we've been saying for a long time, and there are studies after study that come out that talk about how the health care law is going to cause health insurance premiums to rise. And there's been a lot of people who've gotten up here in the Senate, others in the administration, in an attempt to defend the Obamacare law, who have said, no, that's not going to be the case. This is actually going to drive premiums down. And we continue to hear that as more and more evidence comes in, not only just studies that are being done out there, but real-life examples of the impact that this law is having on insurance premiums. In fact, there are some actuarial studies that have estimated premiums in various states around the country and what the impact on premiums would be. State of Colorado, in the individual market, the estimate is by the actuaries that the insurance premium rates are going to go up by 19%. State of Indiana, by 95% in the individual market, by 10% in the small group market. State of Maine, estimates are that the individual market premiums are going to go up by 40%, 9% in the small group market. State of Minnesota, in the individual market, 42% increase in premiums in the individual market and 20% in the small group market. State of Wisconsin, 30%, Madam President, in the individual market increase. The state of Ohio, last month, Department of Insurance announced that the average individual market health insurance premium in 2014 will cost 88% more. According to Ohio insurance regulators, the department's initial analysis of the proposed rates show consumers will have fewer choices and pay much higher premiums for the health insurance starting in the year 2014. Well, it shouldn't be any big surprise, Madam President, when you look at the requirements in the new health care law. The new health care law said that there are certain, you have to have a certain kind of coverage. You can't continue to offer coverages that are available to people who might want to have different choices about what types of things they want covered, what they want their co-pays or their deductibles to be. Basically said if you're going to offer a plan, you have to offer this plan. It's a government-approved plan. And it has to have these sorts of coverages and these sorts of things and these bells and whistles in it. It also said that you can get insurance after you get sick. It's called guarantee issue. No longer do you have to, is there any requirement that you go out and get insurance to protect yourself and prevent yourself from having to be in that situation when illness strikes. Now, if you get something, you get sick, then you go out and buy insurance. It also requires community rating, which changes the way in which healthcare costs are distributed across the range of people that are covered by healthcare premiums in this country, and making it more expensive for younger people to get their health insurance coverage. And that's why you're seeing these steep increases in the individual market. And so, Madam President, when you look at Madam President, I would ask unanimous consent to be able to continue for a couple of minutes.
2 minutes? Good.
So when you look at all the mandates, the new requirements in the legislation, the new taxes in the legislation, when you look at all the states that are trying to deal with this and cope with this, all the small businesses, and the small businesses obviously weighed in heavily, and that's why, as I mentioned earlier, the White House said, look, we're listening, we got the message, so they waived this, they delayed this at least for a year for the sort of small businesses under the employer mandate. All we're simply saying is, look, there are lots of problems associated with this law. This was a bad law. It is based upon broken promises. It promised lower premiums. We're seeing higher premiums. It includes higher taxes. You're going to see effects all across the economy when it comes to jobs as people cut back and start forcing people into part-time jobs so they're not hit with the employer mandates under this legislation. So it affects jobs, it affects the economy. We've got a sluggish economic growth rate. It's now been adjusted down to 1.8% in the last quarter. We continue to sort of muddle along. And one of the reasons for that, Madam President, is because we here in Washington, D.C. continue to pile more and more costs on employers trying to do business in this country. And until we understand that if we're going to create jobs and grow the economy in this country, we've got to make it less difficult and less expensive for employers and job creators to create jobs, we're going to continue to see this trend in the future. And so I would simply say that to my colleagues here in the Senate and to the administration, that if you're going to delay implementation of the employer mandate for a year, let's delay the individual mandate as well. And let's not just do it for a year. Let's permanently delay this. Let's start over. Let's do this the right way, and in a way that actually reduces premiums and health care costs for people in this country, that makes it less expensive and less difficult for small businesses to create jobs and to grow the economy, and to get Americans back to work in good jobs that pay well, that increase the take-home pay, so that they can provide in a better way for their families. Madam President, with that, I yield the floor.